I'm Russell Jones, and I'm going to be talking to you today about the work the Center has been taking forward over the past 8.5 years to integrate health into the spatial planning system. Healthy urban planning is an international movement. It's called different things in different parts of the world, but in Europe it originated with the WHO European Healthy Cities Network, and that's why Glasgow is involved in this, because of our continued membership in this. And they've been very, very supportive in taking this work forward. It seeks to enhance the physical, mental, and social, as well as environmental well-being of people who live and work in cities. It's about planning for people, and what that means is placing people's needs at the heart of the spatial planning process, as well as considering the implications of planning decisions for human health and well-being. We strive to create a balance between social, environmental, and economic pressures. And this is particularly relevant for Glasgow, where planning is driven by regeneration and economic growth. Ultimately, what we're trying to do is create an environmental infrastructure where people have the opportunity to optimize their health. There are a variety of different ways that planning can affect health. Here are some that are highlighted in this slide. They can impact on the conditions in which people live and work, their access to facilities and services. It can help to create an infrastructure to facilitate healthy lifestyles as well as social networks. Planning can have an impact on quality of place. This in turn has an impact on mental health, well-being, and quality of life. Planning through meaningful engagement with local communities can also impact on mental health and well-being by allowing people a say over what's happening in their local area. And planning has an impact on issues of sustainable development, which is also closely linked to issues of health. So what do we know? Well, studies have shown that place and space have an impact on human health and well-being, and that individual actions for health improvement can either be facilitated or constrained by the environmental and socioeconomic contexts in which they take place. The direct impacts are traditionally associated with planning and environmental health, things like air quality, both indoor and outdoor, water quantity and quality, as well as traffic-related injuries. Much of the evidence is quantifiable in this arena, and causal effects are attributable. There's another body of evidence where studies are focusing on the influence of the design of the built environment on determinants of health, things like perceptions of the local area, social connections, and physical activity, which in turn have an impact on physical and mental health outcomes. This area of work is the nature of the questions are very complex. Therefore, most of the studies aren't designed to attribute causality. And the evidence is not yet quantifiable. For example, David previously mentioned Rich Mitchell's work on green space. And we do know that as a result of this work, that proximity to green space has an impact on certain types of mortalities. And there's a differential effect depending upon where you live, that the protective effect is stronger in areas that are deprived than it is in areas that are affluent. However, we can only begin to speculate the mechanisms of how this works. So, is quality of place an issue in Glasgow? Well, information from the Scottish Vacant and Derelict Land Survey certainly indicates that it is, with more than 50% of the population living within 500 meters of vacant and derelict land, much of which is contaminated. Some recent work by a visiting Fulbright professor at the Glasgow School of Art, Juliana Mante, showed that proximity to vacant and derelict land is associated with negative health outcomes. I'd like you to reflect. How many of you live within 500 meters of vacant and derelict land? You don't have to answer that. The news isn't all bad. There are some really high quality places in Glasgow, places that are welcoming, that are well cared for, that are looked after, that encourage people getting out and about, where access to green space and amenities is easy and it can facilitate positive health outcomes. However, there are a lot of places within Glasgow that are not cared for, that are unloved, that are unwelcoming, and have a detrimental impact on health and well-being. Our approach in Glasgow to integrate health and planning was multi-pronged, and a lot of this was to do because of our interaction with the Healthy Urban Planning Subnetwork of the European Healthy Cities, and their suggestions that you couldn't just take one approach, you needed to have a variety of different areas that you could do. So we started off, and I cannot tell you how many meetings I went through at the very beginning, talking to people with their eyes rolling into the back of their head, saying, oh, please go away. Just to raise awareness, and we had a series of seminars and workshops to not only raise awareness of the links between planning and health, but to build motivation to take the work forward. We have also endeavored to build on the evidence base, and we've done this through primary research, through evaluations of interventions, through evidence reviews, through finding new ways of communicating that evidence to try and ensure that evidence does influence practice. We've worked in partnership to embed health in strategic documents, and this is important because it provides us a hook and leverage for taking things forward. However, we recognize that embedding health into policy is not enough to change the environment. We've got to change the way people work. So we've worked in partnership to help build capacity and change practice and overcome professional boundaries. These are just some selected examples of what we've done, and I don't have time to talk about all of them, and it's not inclusive of all the work that we've done either. But I'm going to focus on one particular project, which is next to the bottom, the Health Impact Assessment of the East End Local Development Strategy. I put this slide up just to show you that in its final version, the East End Local Development Strategy, which will guide all of the development for the East End of Glasgow, including the area where the Commonwealth Games development is going on, not only takes into consideration sustainable development, but also addressing population health, environmental quality, and meeting people's needs. What Health Impact Assessment is a whole toolbox of methods and approaches where you can take a policy or program and make judgments about the potential health outcomes of that policy or program. And the unique aspect of Health Impact Assessment is that it not only looks at negative health impacts, but also positive health impacts, and makes suggestions or recommendations to enhance the positive and mitigate the negative. The method that we chose for this was a prospective appraisal because it was a very, very early draft of the East End Local Development Strategy. It involved a 2-day participatory stakeholder workshop where we had people from a variety of backgrounds: health, planning, local community, local housing associations, Scottish enterprise, Scottish government, and I'm sure I'm leaving some out, but a wide variety of backgrounds. The 2 days involved a half-day site visit where we wanted people to go and see what they were going to be talking about. And then also we split up into work groups, and we made sure that the different tables had people from different backgrounds. And the priority was that everybody's voice had equal importance, that nobody was more important than anybody else around the table. We did a lot of work prior to this to develop community profiles with health indicators for the existing population, as well as providing a list of health determinants that were relevant to the local development strategy. That's my break. I'm not going to go through all of this, but these are the issues of concern to stakeholders, and the reason I put it up is just to show you the breadth of things that were coming out of the HIA, everything from accessibility to connectivity, to choice of housing, to sustainable transport and employment. There were a lot of suggestions. Some of them could be directly implemented into future versions of the local development strategy. Some of them required liaising with other organizations in order to take them forward. So the direct successes were that it did actually influence future versions of the LDS. There were very, very few suggestions that were rejected. Most all of them were incorporated into future versions. And it also provided a forum for meaningful communication. Planners remarked afterwards that it was surprising to them that when local community members started talking about a way that the place made them feel, that they automatically started talking about placemaking. Additional successes from the HIA was that the council embarked on a whole series of additional health impact assessments. I'm not going to list them all here, but it ultimately led to a council officer being seconded to Scottish Government to work on an integrated impact assessment tool that integrates health and equality impact assessments. And this has now been taken forward by Glasgow City Council. They've trained employees in a variety of different departments and are undertaking it on major strategic developments. Another additional success that came out of the HIA was the concept of integrated infrastructure. What this is integrating sustainable urban drainage systems with a green network and a movement network. Previously, traditionally, SUDS, or sustainable urban drainage, is a holding pond surrounded by a fence. The reason for this is low maintenance and the consideration of health and safety. But what came out of this particular HIA and is incorporated into the local development strategy is the idea of a canal network that developers can buy into, and then that way you can green it and you can provide an activity network as well. This has been taken forward and developed by Glasgow City Council, the Green Network Partnership, SEPA, Scottish Water, and others to develop a series of design studies, one of which actually won an award, the one in Nitz Hill. And you can find these design studies on the Green Network's website. The slide gives you an idea of how the concept was further developed and bringing in some other issues. Another additional success was that the health impact assessment led to further innovative community engagement. And the council was actually the only UK city that was recognized by the National Social Marketing Centre for the work that it did here, won an award for it, and was featured in a film. And I'm not sure this is where you're going to be dimming the lights. Yes, no?
Despite years of regeneration, the East End of Glasgow suffers from some of the worst health statistics in Europe. A boy aged 15 in this part of the city has only a 50% chance of reaching his 60th birthday. While formulating the new local development strategy for the East End, a planning team in Glasgow City Council saw a clear link between planning policy and health.
All the surveys that you do in the East End of Glasgow, it cries out that health is one of the main factors in determining the quality of people's lives. We wanted to create a local development strategy that in some way tried to address those issues.
The planning team came in and they were really good at recognising that people had really valid, strong opinions in the local area and that they have local knowledge that perhaps planners don't have.
Some of them are amazing. The pictures are really eye-opening, issues that you perhaps don't pick up working in the area. Some of these images are just incredible in terms of what people are experiencing in their daily life.
This is a designated play area for a lot of the local children in this housing development. When the planning application went in from the developers, they have to attach a certain amount of green space, and this is how it worked out. And so this is where we're supposed to send our children to play.
What we established in the scrapbooks was that people were concerned about where they go, how they feel when they go there, do they feel safe, is it well lit? It became obvious that people wanted to be able to walk comfortably in an environment where they felt good about themselves and about where they lived. There is clear evidence now that people's physical environment and where they are has an impact on their quality of life.
Once again, I'm going to ask you to reflect, because I think it's quite striking, the play area where they're expected to send their children to play in this. I certainly know that the area in which I live has much higher quality play areas than what is supposedly acceptable there. Another success from the HIA and the community engagement that occurred was that Glasgow went on to be designated a test site for Equally Well to explore how integrating health and planning could help to address health inequalities. The overall vision was that planning can be more about people. There are a variety of different projects, some community-led, public sector-led, some capacity building stuff, some tool development, and innovative ways of communicating, such as this is just the front cover of a cartoon that we developed that showed how that planning and health, by working together, could help create healthy, sustainable neighborhoods with people at the heart of the entire process. There are some challenges that we're facing, though, in moving this agenda forward. Certainly, the current economic climate with the loss of staff and other resources has reduced capacity, and this might lead to a retreat to silo thinking and working. Or it might be seen as an opportunity to help take things forward in recognition of the fact that you can't continue to deliver the same amount of service with less people and less resource. There's an ongoing challenge in that we are dealing with different types of organizational cultures with the different bureaucracies within Glasgow, with different accountability structures, different ways of working and delivering services, and it's finding a way through all of that and working together and overcoming those professional boundaries. And one of those boundaries happens to be finding a common language, because the same words can mean completely different things to different people. For example, the word evidence means something different to planners than it does to people with a public health background. And I've also found that the word health can be a barrier in taking this whole agenda forward, because when people hear the word health, they think about people being ill. Therefore, that's in the remit of the healthcare service and not within their particular remit. So you've got to find a way of finding shared priorities and moving it forward and being willing to give up your own ideas about how things should go forward. And we ultimately, because of the fact that planning is driven by regeneration and economic growth, we have to find a way to move health from a competing priority into a complementary one. So we're moving from a vice versa, or versus health versus economy, to a win-win type of situation. So we plan to continue our multi-leveled approach. We plan to continue to build on our successes. We have achieved quite a lot, but the work is by no means complete, and so we want to continue to build on the growing momentum. Thanks very much.